Thank you. Great. Well, thank you. We're before we break for the network, we want to be able to have a session with our partner, our innovation partner and reception partner today, Reckitt Global Hygiene Institute. So I'd like to welcome to the stage David Wheeler, who is the Director of Strategy and Operations at Reckitt Global Hygiene Institute, and Dominic O'Neill, who is the Executive Director for Sanitation and Hygiene Fund. Hopefully we have David here, and surprised, just a little bit earlier session than we were planning, but I know Dominic's going to have to run to the UN here quickly. So thank you. Thank you both for being here. Right. So David, I'll start with you. Reckitt is a maker of many household name brands that maybe if people aren't familiar with Reckitt, they're probably familiar with many of your brands. Lysol being a big one that I think a lot of people stockpiled in the pandemic. But you started this Hygiene Institute just in 2020, so kind of right in the middle of the pandemic. So why did you create this? And what are you looking to do with this institute?
Yeah, thank you. Reckitt put forward a $25 million gift to create a private foundation, to create an independent research agenda focused on hygiene. Hygiene being a field in need of nurturing and investment, and really looking to build a portfolio of evidence that fills the gaps and will inform us how to achieve the ultimately important results from investment in water and sanitation infrastructure that can result in real life-changing health gains for communities. So in creating this gift, it was really quite unique in the sense that they put actual cash behind this private foundation, and in giving us the freedom to really build an independent sort of grant-making infrastructure that wasn't really, it's not brand-driven. It's really driven by, the value created through the research. The advantage of creating something new during the pandemic is everybody is actually quite available and at home. So, it's really was quite enlightening and wonderful in the sense that we got a lot more access to people who are very busy and difficult to talk to because they're often on planes and going to conferences and meetings. They were all very much more available than they had ever been in their lives, I think. So that was really wonderful.
And so you are also organizing a global hygiene summit later this year in Singapore in December. So what are some of the conversations you're looking to have there, and what are you hoping to get out of that summit? And then what are you also looking for out of this week and the conversations you're having in New York to help inform the conversations you have later this year?
Sure. The Global Hygiene Summit occurring in early December of this year, we're working to bring together the practitioners of hygiene, the researchers in the hygiene field, and the related multilateral parties to have a conversation specifically about hygiene, which is something that hasn't happened very often, if ever, occasionally on the side of some larger meetings. But we really think it's very important to connect across the networks of people who are working in hygiene, working with directly with the aid organizations, with the hygiene behavior change researchers and the health economics researchers who are really going to put together a viable investment plan for hygiene behavior change long term. Again, making sure that we take all of these infrastructure investments and get the maximum benefit out of it for the societies and communities they serve.
And so, Dominic, you lead the Sanitation and Hygiene Fund, which is a UN fund that works to really catalyze work around access to sanitation and hygiene. Why is
menstrual health?
And menstrual health, yes. And Anita had some really great points on that in the previous discussion, and particularly the stigma around it. And so, hygiene is under maybe funded, under discussed topic. Why do you think that is the case, and what do you think needs to happen to change that?
Well, it has been. You know, I've worked in sanitation hygiene for many years. Started off in refugee camps in Tanzania 30 years ago, and saw then, during the middle of a cholera outbreak, that there was a lot of work going into the the treatment of cholera patients. Very important work, but there was nobody looking at the sanitation and hygiene. That was way back then, and as I've come back into the sector very recently, I've unfortunately seen that there hasn't been enough change. So, and the model we've adopted is, rather than looking at, well, you know, ODA needs to pay for this, you know, the aid budgets need to pay for this, they do, but exactly as my boss, Anita, described, we need to be smart in how we use our finance. And we need integrated solutions around SDG 6.2, you know, good, safely managed sanitation, adequate, affordable hygiene facilities, and accessible menstrual hygiene practices. But we need to look at how we're going to mobilize a capital to actually make that viable. And that's our business model. So rather than just focusing and advocating that something has to happen, the business model we present allows the investors who wouldn't otherwise look at sanitation or hygiene or menstrual health as an investable proposition. We're shaping it and using a lot of lessons learned actually from off-grid energy, where 15, 20 years ago, you know, there was a few wind-up radios being sold, and now they've been put together at investment-sized tickets that attract the multilateral investors, impact investors, philanthropists, at a level that is making a significant impact. So it is about continuing the advocacy, explaining the importance. Hopefully, if there's anything that came out of the pandemic, it's that we know the importance of good hand hygiene and good sanitation, and we need to be prepared for future incidents like that. It's always been the case. A bar of soap is the best, you know, treatment against this disease. But what we need are the investment propositions that will make everybody comfortable, and they'll know how to invest in and achieve the drastic scale up in sanitation, hygiene, and menstrual health that we need to see.
So another thing that we realized in the pandemic is that we can do big, hard things quickly if we mobilize stakeholders' resources around it. So seeing record manufacturing of vaccines. So why haven't we seen this kind of response to some other diseases that are related to hygiene, you know, TB, cholera, as we've been talking about, recent outbreaks there? So what are your thoughts on maybe how the private sector can play a role in accelerating progress on this? Maybe not quite to the speed we did in COVID, but something akin to that.
Well, I think the key here is that the specificity, duration, and applicability of non-pharmaceutical interventions that sort of reside in the realm of hygiene are not very well understood, and their applicability and specificity for preventing disease transmission is not very well understood, which makes the practice of hygiene, whether it be in a refugee camp or, you know, in a community, very, very difficult and in sort of responding to the risks at hand, right? RGHI is putting a research program together that is really focused on allowing people to practice hygiene with dignity in a resource-appropriate way for the communities that they live in, which includes MHM. It includes being able to go to the hospital and not developing a hospital-acquired infection. But, you know, those big research gaps in hygiene are really holding us back from being able to have compelling answers that allow people to really adopt the habits of hygiene and adopt them in a way that is durable. And the durability of habit adoption is so important because as we look at the economic models of WASH investment, one of the most important things that comes up over and over again is, are people willing to continue to pay for the infrastructure that has been created through the initial investment and maybe facilitated through risk reduction and other things? If they're not willing to adopt that habit permanently, then the economic models become very difficult to sort of keep going because eventually people don't pay for the infrastructure. So when we look at hygiene habit adoption, we're really looking at it as like, there's more than just saying, hey, you adopt these habits because you're trying to be healthier, right? That's not enough motivation for an individual in a community to continue these practices. And so you need to look at the dignity, the human right aspects of it, and the health aspects of it, and be specific about what health benefit that they're achieving. And if you do that, then the economic models of WASH investment can really move forward with confidence, in the sense that we're going to drive habit adoption that will then result in people valuing these services in such a way that they continue to invest in them. They develop the expertise to maintain them. They gain everything within their community, you know, till it becomes part of the societal fabric.
And Dominic, I guess we're about halfway through this UN Water Conference. And what have been the conversations you've been a part of so far? What do you hope to see come out of this? And do you think you'll be able to get hygiene more on the agenda after tomorrow?
No, I really hope we can, yes. Our particular focus, obviously water is a very broad agenda. Our particular focus is achieving the familiarity and the acceptance of the sanitation economy. We've just released a report today where we valued the Nigerian sanitation economy at $8 billion as of today, with the potential to grow to $14 billion. So getting people comfortable with that as an opportunity, and one that where we can engage ministers and key stakeholders, not just about the essential and the human right to water and sanitation, but also the economic opportunity from local SMEs, from jobs being created, and to have a holistic approach, local service providers. And you know, so these are national companies that can be adapted so we can create economic opportunity, as well as a much needed human dignity and the human right to sanitation and menstrual health.
Yeah, well, we established earlier that maybe it's not a lucrative business, but do you make the case that it could be?
No, the economic approach, the issue has been that we've been looking at too small investments. So yes, if you look at a single sanitation investment, as if you look at a small off-grid energy investment, it's simply not profitable. But through efficiencies and also achieving scale, then, and we've done this. I was at the African Development Bank for 3 years, and we were working on these sort of macro models of financing, and you know, it is being applied in different sectors. You can achieve this scale. And what actually sanitation hygiene provides are low, slow, but steady returns, which are counter-cyclical. And actually, pension funds and institutional investors will appreciate that over a 30-year period. It isn't a hidden telecom sector that was suddenly being discovered, but it is a steady investment that gives valuable social human impact. It keeps girls in schools. It has all of that value, as well as the ability to create unskilled and skilled jobs in the economy. So that's how we have to think: long-term, slow returns, and the investment size at a sufficient size that it gets over the hurdle of the investability.
And what are some of these additional hurdles that you see in financing and getting enough people to the table to bring, you know, to bear the resources needed to make?
You know, I think it's really in building a solid evidence base, you know, of showing scalable and transferable between communities, so scalable and replicable interventions that will sort of achieve both the disease reduction, the disease burden reduction, and also bring, you know, the added human element of being able to practice safe hygiene with dignity in these communities. So I think when you add those two pieces together, if you can articulate that message and be specific about what health elements that you're bringing to the table, then the low, slow return is going to be available to the financing mechanisms and make the infrastructure necessary to practice hygiene something that can be achieved at a large scale.
Are there any examples of countries or places you think are doing this well?
India has an economic sanitation economy worth $94 billion today, and the way they're tackling this is by a flourishing sanitation economy full of local SMEs providing off-grid on different types of sanitation models. They've had fantastic political leadership. They've opened up, they have quite a vibrant financial infrastructure. There's still a long way to go, but there has been a leap made there, and it's been made through encouraging and activating the local private sector. We're not just talking about the big corporates. Local private sector, often with women-led enterprises, as it happens, Toilet Bowl Coalition have been incubating a lot of them. And letting those flourish. The public sector, the governments have to play a role. They have to set the governance framework, whether that's concessions and tariffs, whatever, and to provide the support. But this is the only way we're going to reach SDG 6.2, especially looking at off-grid solutions which are going to reach those most left behind, and coming up and thinking innovatively and getting different people in the room who have been working on different financial models in different sectors, and bring that experience to the table.
Right, and David, if people want to get involved in the Hygiene Summit later this year, will you be around? How should they?
Yeah. So you can find a link to it at rghi.org. And again, we're really looking forward to getting practitioners, researchers, and policy implementation people together in Singapore.
Great. Well, thank you both. And again, thank you to Reckitt Global Hygiene Institute for being our innovation partner and our reception partner. We will pause for a networking break. We've got some great snacks and drinks around. Then we'll come back here to finish our program, and then we'll wrap up with the reception at about 5 o'clock. So thank you both, and thank you all.